Hello and welcome to Chapter 16, General Pharmacology for the EMT. We are going to talk about um, what medications you guys can administer, the general information about medications and medications that patients often take, and assisting with IVs therapy. Okay, so let's get right into it. So medications that EMTs can administer: aspirin, oral glucose, oxygen, activated charcoal, and then there are a multitude of medications that you can assist with. Um, and what I mean by assist, you can help the patient take those medications. Now, when you assist with those medications, you still have to know what they do and how they work on the body. Okay. So aspirin is administered to patients with chest pain, um, with a suspected cardiac origin. Um, Oral glucose can help patients with diabetes. Oxygen can help with hypoxia. It can help with pain. It's kind of a good type of deal. Okay. Activated charcoal is used in poisonings, and it really only works with volatile substances. So a bronchodilator inhaler, this is a metered dose inhaler. You can assist with these. We don't necessarily carry them on the trucks any longer. Some services may still carry them, but we just don't. But a bronchodilator inhaler, the MDI, the metered dose inhaler, it helps with respiratory problems. So prescribed medications that you can assist with, okay, is the inhaler, nitro, and epinephrine. So bronchodilators are used in patients with asthma, emphysema, and chronic bronchitis. They enlarged and the constricted breathing bronchioles. It does have side effects such as increased heart rate and patient jitteriness. Okay. Nitro is often prescribed for chest pain. There are several different forms of nitro. You can see nitro in a small tablet form or in the spray like here. So it's taken by patients with a history of chest pain or cardiac origin. That's where it's prescribed, and then they take it for chest pain. And it helps to dilate the coronary vessels. Contraindications include a low blood pressure, systolic of less than 110, 100. So I'm not going to give it to anybody with a systolic less than that. And patients who are taking medications for some type of erectile dysfunction, Viagra, Levitra, Cialis, or something like that. And then that does have a side effect of dropping the blood pressure. Because remember, what are we doing? We're dilating those coronary vessels, and we're increasing the size of the vessel, but we're not increasing the fluid inside that vessel. So it's such a big vessel that your blood pressure is going to drop. Okay. Epinephrine autoinjectors. These are prescribed for patients who have a severe allergic reaction. They take it for anaphylaxis. It's a vasoconstrictor. So think about what it does. So vaso is vessels and constrict is constriction. So it constricts the vessels. All right. It relaxes the smooth muscles and airway passages, and then it has the side effects of an increased heart rate and blood pressure. So other drugs that sometimes may be administered, you guys can give Narcan as long as it is in the pre-dosed injectors. Okay. You can't draw it up or anything like that, but it can be in the pre-dosed injectors. It's an antidote for a patient who is unconscious and in respiratory failure after taking a narcotic. Okay. It does not work if the patient has not had a narcotic. Okay. This is something that I will step up on a soapbox. I firmly believe that PD does not need to have Narcan in their possession. Sorry, that's just the way I feel. I firmly believe that you should work through your primary assessment first. And what happens in your primary assessment? ABCs, okay? Those are the first things that we do. Those are the first things that we have to correct in order to fix the patient, okay? Then after we've done that, we can then start to figure out what's wrong with the patient and whether or not they need Narcan. So in order to fix the respiratory failure, you need to breathe for your patient. They need an open airway and they need respiratory assistance. They need ventilations. That should be your first line of defense and first treatment to fix their problem. Because if you're not fixing that problem, then yeah, Narcan's probably going to work, but we're just overloading them with Narcan. Okay, so now I'm going to step off my soapbox. So force protection medications, the atropine auto-injector, it's used for terrorist attack, like gases and various other things that it can be used for. Okay. Again, all of these videos and skills are in the skills section of the online classroom. So go down there, look at those, watch those. Okay. So general information about medications. So each drug is listed by its generic name, and it has at least 3 names. Okay. So there's the chemical name, the generic name, and the brand name. So 1 or more trade names given to the drug by manufacturers. So let's take nitro, for example. Okay, so nitroglycerin is the generic name. Don't ask me what the chemical name is, because it's probably like really long and got lots of chemical properties that I don't know. So the trade name, or the generic name is nitroglycerin, and then the trade name would be like nitrostat, nitrotab, or something like that. Okay. So what you need to know when giving a medication, you need to know the indications, the contraindications, the side effects, and any untoward effects of that medication. You also need to know the form of the medication, how it comes to you. So is it a compressed powder or tablet? Is it a liquid, a gel, a suspension, a fine powder? Is it a gas? Oxygen is a gas, okay? Or is it a sublingual spray? So medication safety and clinical judgment. So administering or assisting with medications is a serious responsibility. And you have to know the medication and use good judgment. If you don't know the medication, then you can't give it. So medical authorization. So think back to chapter 4, chapter 2, somewhere around there. We talked about offline and online medical direction. So offline is those standing orders, the protocols, the guidelines, the SOGs, SOP, all of those things go into offline medical direction in what your physician decides that you can do, okay? Your online medical direction is when you speak directly to a physician at an ER or at a designated physician. So you're going to listen to the order, repeat back the order, and then ask for clarification if necessary. Okay, so When giving medications, there are 5 rights that you have to make sure that you do for every single patient. Okay, so the first one is, do I have the right patient? Is this the right patient to give this medication to? Number 2, is it the right time to administer this medication? Okay, so do we have the right, is this the right time to administer this medication, or should we do it later, or am I too late to give this medication? All right. Is this the right medication? So we want to make sure that it's the right medication that we're going to give to this patient. So if we're not giving the patient medication, if we're giving medication to a patient and we want to give them aspirin and instead we pick up the nitro, you know, we've got to make sure that we give them the right medication. Okay. Is this the right dose? Okay. How do you know what the right dose is? Well, it's in your protocol. And then there are generic doses that we give at EMS. Okay. So whenever you give a tablet or a spray of nitroglycerin, it's always going to be 0.4 milligrams sublingual given. Okay. When you give aspirin for chest pain, it's always going to be 324 milligrams chewed buccally. So we know that those medications are the right dose. Okay. We just got to make sure that we either pull up the right dose or give them the right dose. And am I giving this medication by the right route of administration? So again, aspirin is chewed, so it's given buccally. Oral glucose is given buccally, on the cheek. Nitroglycerin is given sublingually. It's given up underneath the tongue. An epi autoinjector is given intramuscularly or subcutaneously, however you want to call it. Let's see. Oxygen is given by inhalation. A metered dose inhaler is also given by inhalation. So you've got to know which route of administration to give that medicine, how to give that medicine for. All right, so what would be the potential risk to the patient if each of the 5 rights were not checked prior to administration? For you guys, the risks are not as high. They can cause problems, such as giving nitro instead of aspirin when your patient has a blood pressure of, less than 100 systolic. We don't want to do that, because what we're doing is now we've lowered their blood pressure even more because we've increased the size of the vessels. So we just can't do that. Okay. So routes of administration. So there's oral or swallowed, sublingual or dissolved up underneath the tongue, inhaled, which is breathed into the lungs, usually from tiny aerosol particles, such as an MDI, or gas, such as oxygen. Intranasally, which is the way Narcan is given, and it's sprayed into the nostrils. And then there's intravenous, or injected into the vein. There's intramuscular, subcutaneous, which is injected up underneath the skin, intraosseous, injected into the bone, and then there's endotracheal, which is sprayed directly into the tube, inserted into the trachea. So age and weight related considerations, pharmacodynamics, the study of effects of medications on the body. What effect will medication have, and how will this medication affect my patient specifically? Patient-specific factors change how medications work. So with regard to the patient-specific factors, we're looking at how old they are. If they're older, their liver probably isn't functioning as well, so they don't metabolize medications very well. They may have grown an efficacy or a tolerance to the medication, so they have to have more of the medication in order for it to work. weight. So if they are overweight, then their body probably has a slower metabolism. So those are factors that you've got to consider when you give medications. Okay. Reassessment and documentation. So after administering medication, we want to reassess the patient, clearly document the medications administered. Okay, so now about some medications that patients often take. This is Advair. It is prescribed as a daily management for asthma or COPD or CHF even. Okay. Herbal agents and what they are sometimes used for. So let's just talk about, there are lots of people out there who take the valerian root for insomnia. You've got a lot of people out there who take herbal medications for various things. Okay. Some other drugs that you'll see are cardiac drugs. They're prescribed medications, respiratory medications. In the older population, you're going to look at like prostate medications, cancer medications, and those type of things. Okay. So assisting in IV fluid and administration. So ways fluids and medications may be administered into the vein is through an IV. We've got a heparin or saline lock, which is where a catheter is placed into the vein, and then there's a lock, a cap placed over the end of the catheter, and that lock contains port for administering medications. You're going to see that on probably every patient, just because it's easier to set up a saline lock. So a traditional IV bag, we've probably all seen one of these. It hangs above the patient, constantly flows fluids and medications into the patient. It has a clear plastic tubing connecting the fluid bag to the needle or catheter. There are three important parts. There's the drip chamber, the flow regulator, the drug or needle port, and then an extension set makes it easier to carry or disrobe the patient without pulling out the IV. Okay, so this is the IV bag. We want to make sure that it's clear, it does not leak, and that it's not expired. So this is the protective covering over the IV spike, and then the tubing that goes to the rest. Okay. The spike goes into, it can only go into one port. This other port here is for injecting medications directly into the bag. Okay, then we're going to fill up the drip chamber about halfway, so that way we can still make sure that we can see the drip coming from here. And then we're going to open up the flow regulator, which is right here in his hand. And it's just a rolling stopcock type deal. Or a rolling clamp, I guess. So troubleshoot flow problems, constricting bands left in place by mistake. When we start an IV, we use a tourniquet, just a temporary tourniquet, to cut off the blood flow, to make the veins pop, and sometimes that can be left, and it will restrict the blood flow or the flow of the IV. The flow regulator is left closed. The clamp is closed on tubing. There's also another clamp farther on down. And then the tubing is kinked or the line is pinched under the backboard. Adjust the flow rate properly. Monitor IV sites for infiltration. When we look for infiltration, we're looking for like redness, swelling, anything that would suggest that the IV is not a patent IV. Okay, so chapter review. Aspirin, oral glucose, and oxygen are medications carried on the ambulance that the EMT may administer to patients under specific conditions. I know I didn't go into them a whole lot. Your book will talk about them more. And you will also see on the assignment for this that there is a drug cards. Okay, so you'll have to do some drug cards on these medications. Prescribed inhalers, nitro, and epi in auto-injectors are medications that, if prescribed, the EMT may assist the patient in taking. Again, it has to be the patient's medications as well. Okay, it can't be somebody else's nitro. It can't be somebody else's inhaler. It has to be the patient's inhaler. It has to be the patient's nitro. So you may be able to administer intranasal Narcan or encounter patients who have received it from a layperson. Again, this is something that we do. We do not carry at Mercy. We do not carry the pre-dosed intranasal inhalers for Narcan. So it has to be drawn up. But if we were to have them, then yes, you could do that. So you may need to have permission from medical direction to administer or assist a patient with a medication. I will say Mercy's probably really kind of, they're not lax, but they allow more freedom in what you can do and what you can't do. Okay, there's a wide variety of medications that a patient may take. You will try to find out what medications a patient is taking when you take the sample history. And these drugs may be identified by a variety of generic and trade names. So your main purpose in finding out what medications the patient is taking is to report this information to your medical director or hospital personnel. You know, as you go on, you will learn what medications do what and what they're prescribed for. You'll see that some patients, you'll see like chest pain patients are prescribed a certain set of medications. Respiratory patients are prescribed a certain set of medications, as are like seizure patients, stroke patients. They're all prescribed pretty much the same things because that's like the standard of care for those patients. Okay. So EMTs can administer aspirin, oral glucose, and oxygen as part of patient care, and then we can assist with these other medications. So you should be able to understand the names, indications, contraindications, and side effects of medications that they intend to administer. You also have to have the appropriate authorization to give a drug, and always, always, always do the 5 rights. You should always also be doing a cross-check with your partners. Okay, if you're on an ALS truck with a paramedic partner, they may give you the medication and tell you, this is what I want to give, this is how much I'm going to give, and this is the route I'm going to give it. Okay, so that's that cross-check method. And it's your responsibility to know, you don't necessarily have to know everything about that drug, but you need to know, specific things like, what's the name of the drug? He said he was going to give this much, but he drew up this much. Is he actually going to give this much? And then check for the, what was the other one? How much, name of the drug, and how you're going to give it. Okay, is it given IV? Is it given intranasally? Is it given IO? How is it going to be given? Okay, so reassessment and documentation are important elements of medication administration. So questions to consider. Should I administer a medication? How can I get more information about a drug? What are the necessary steps that must occur after medication administration? So a patient is complaining of chest pain. Here's some nitroglycerin, says a family member. Give him that. What do you do? Okay, so make sure that it's the patient's nitro. And if it's not, then we don't give it to him. Because He wasn't prescribed it, so we're not going to give that medication to him. So just remember those things. All right. Remember your 5 rights on that one too. So that was the end of chapter 16, General Pharmacology. I know it was quick, but if you have any questions, let me know. And you can leave those questions down in the discussion post below this lecture, or you can email me, text me, call me, and I'll try and answer those questions as well.